If you've ever had LASIK surgery or if you have ever considered getting LASIK surgery, I highly recommend watching this interview. I sit down with Dr. Cynthia, who talks about all the risks of having LASIK surgery, if anyone should be getting LASIK surgery, and what are the actual consequences of getting this procedure done. I now eat a lot of meat, and so do they. If you want to thrive, you need to eat meat. Meat is required. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private functional medicine practice where we focus on root cause healing, and that often starts with the Carnivore Cures all meat elimination diet. Today I had the pleasure of sitting down with Dr. Cynthia MacKay. She is an ophthalmologist, was considered one of the most renowned ophthalmologists of all of the US. In the 40 years that she was a surgeon, she started to see things about LASIK that she was getting gravely concerned about. We talk about LASIK in detail, and then we talk about just overall eye health and how to best support eye function. Offline, Dr. MacKay also told me about how she had an hip injury that caused her pain and chronic pain that then ended up rewiring some of her brain function. She ended up writing a book called Making the Cut. And in that book, she talks about her journey as a surgeon, as well as what happened with her chronic pain. If you are interested, you can also find that information in the show notes. Let's get right into the interview. Hi, Dr. MacKay. Thank you so much for joining me today. For the people that may not have heard of your work yet, if you can introduce yourself and what got you into ophthalmology.
Yes, well, I practiced ophthalmology in New York City for 40 years. I've retired. While I was practicing ophthalmology, I became clinical professor of ophthalmology, Columbia University College of Physicians and Surgeons, which is their highest academic rank. And I was working in the Harkness Eye Institute at Columbia Presbyterian Hospital one day in the 1980s when one of my colleagues came running in and he handed me a piece of paper and he said, "Look at this." And it was a cornea that had a perfect rectangle sliced out of it. And he said, "This is going to revolutionize ophthalmology. We're going to reshape the cornea and people won't have to wear glasses." The minute he said that, I knew it was going to cause terrible injury to the eye. So here's the eye, and here's the cornea, the front part of the eye, and it's packed with nerves, just packed with nerves. It has more nerves than any other part of the body. So if you cut into this cornea, you're going to cause terrible pain, inevitably, no matter where you cut it. If you cut on the surface, if you cut in the middle. And also, I knew that would weaken the cornea and cause all kinds of problems that way. And also, I knew that when it healed, there'd be scar tissue, so would ruin vision. So I thought, horrible complications, pain, other disasters. Nobody's going to buy it. I thought it would never go anywhere. But two things happened. First of all, when the doctors explain the procedure to their patients, and you know, if you've ever had surgery, your doctor sat down with a consent form, and the consent form described all the possible complications. They don't describe the complications, and they don't give the percentages. Would you have a procedure on your eye if you had 75% chance of living for the rest of your life with a horrible dry eye that you couldn't treat, that never got better, that was permanent? Would you have this procedure if it was explained to you that inevitably 100% of the time you would get halo and glare around lights and dazzle, and that you wouldn't be able to drive in dim light? No, you wouldn't. So the patients, the trusting patients who think doctors are always doing good things and they have their best interests in heart, the patients come in and the doctor says, oh, there's only a 1% chance anything will go wrong. That's not true. That it can be fixed, not true. All the complications are permanent. So that's the first problem. The second problem is other ophthalmologists won't speak out. A whole lot of them feel exactly the way I do. So many ophthalmologists feel this way, but they're not going to speak out. This is a very profitable business, and they don't want to be criticizing this business when it's making a ton of money for other ophthalmologists. So the whole thing is a disaster. And if you can talk all the people on your podcast out of having LASIK, you will be doing a huge public service.
Thank you for that. So let me take a step back. I want to first commend you for all of your advocacy for sharing about, and so we're talking about LASIK surgery, how a lot of people are told that if you do this really quick surgery in and out in one day and you'll have better vision and you don't need to wear your contacts, the annoying glasses. But before I get into that and we get more deeper into this area, I do want to commend you for, again, the advocacy. And I think that in your career, it's the American Academy of Ophthalmologists. They have awarded you as, some of the best doctors. So you had such a prestigious career in this field, and then you decided to, share these truths of what's really going on in LASIK, and then you sort of got the field wasn't happy that you're sharing all this information. So I do want to take that moment and commend you for that, because it's not always easy to go against the grain. So now, with all that said, let's talk a little bit about LASIK. The reason I even fell into this and wanted to have you on is my husband hates wearing glasses. And so I thought, why don't we get LASIK? It's the prices have come down, and then only to hear that there are risks. And he actually mentioned, and the reason he didn't go through even with the actual procedure was he has a friend that's an ophthalmologist that told him that he had a patient that I think it was one eye that went completely blind. And that was enough of a scare that he didn't actually get it. But why is it that in the consent forms, we are not being told about the risks of these things that are happening with LASIK surgery?
If the consent form was accurate and explained all the problems in language that the patients could understand, and if it was truthful, nobody would have LASIK. And what sometimes happens, I've had many patients tell me this, is they walk into the doctor's office, everything's glowing, there's a movie showing how wonderful LASIK is. The doctor says it's the safest procedure ever. And then, just before they have the procedure, when they've had the sedative, when their eyes are dilated and they really can't see anything, and when they've already paid for the procedure, suddenly they're handed this consent form, and the procedure is going to be done in 20 minutes. And it's pages and pages and pages long, and they have to initial each finding. And at this point, they feel trapped. They've paid for the procedure, and they say, oh, the doctor, these are all complications. That won't happen to me. And they go ahead.
Right.
Now, I was a surgeon for 40 years, and that's what I did. And with every consent form, I had to explain the complications, the risks, the alternate therapies, and the benefits. And they don't explain that accurately.
So do you think that no one should do LASIK surgery?
Absolutely no one should go near LASIK. It's much too risky. Nobody should do LASIK. It's written on the sky. LASIK will not be done in another 10, 20 years. It's much too risky.
Yeah, I saw a news brief that 2 years ago, the FDA was considering putting some type of warning and putting more stipulations for the consent form before people even consider getting it, because they are getting more and more complaints. Another side said maybe we just have optic nerve specialists or the cornea specialists do the surgeries only. Do you have any thoughts on that, or should it just be that no one should be getting these? Hey guys, just a really quick break. Nutrition with Judy's private practice is now called Empower Functional Health. I started as a nutritional therapist, but we have become much more all encompassing. At Empower Functional Health, we do functional medicine, chronic illness, autoimmune, gut health, environmental illness such as SIRS, mold illness, Lyme. Regardless of all these names, the goal for us is always to get you root cause healing answers. And of course, carnivore, the all meat elimination diet is always on the table. Food, the right food, is always medicine. We offer functional tests, prescription meds, and really everything to get you closer to root cause, where you can just eat the meats you enjoy and live the life that you are meant to symptom-free. The goal is to get off meds, supplements, and everything else that your body no longer needs support in. Our practice, whether it's Nutrition with Judy, sharing podcasts and free content, or our private practice, Empower Functional Health, our goal is to support you guys in the barbell theory. We give a lot of free content, our evidence-based research. We don't use Substack. We give all our stuff away for free. We interview with the best and make it super tactical so you have clinical pearls that you can walk away with and try in your own healing journey. And then we work with some people in a smaller subset, one-on-one, to provide that level of personalized care. And as we heal these people that are chronically ill, we find these clinical pearls and golden nuggets that we can share then more publicly so that we can make wellness for all. Hopefully, the content and the guides and the free stuff we give out is enough for you to heal. But if it's not, you can always come and work with us in our private practice so that you can get more personalized care. If you want to learn more, make sure to check out empowerfunctionalhealth.com.
No one should be doing this. Whenever you cut into a cornea and you're cutting it to change its shape, you are cutting nerves, you are making the cornea thinner, you're distorting the cornea, and 100% of people after this procedure, 100% lose contrast sensitivity. They can't see between
different grays.
So it's something you shouldn't do. Your cornea is so special. Your eyes are so special. You need them. You need them to see the world. And if you have LASIK, 100% of the time, you'll get in dim light halos and starbursts and distorted vision, 100% of the time. Some people are able to ignore them, but you shouldn't be driving at night if you've had LASIK. There's too much glare and dazzle. And it's just a procedure that takes a healthy eye and turns it into a sick eye. The eyes are never, ever healthy again. You can see chronic inflammation in the cornea with scans. You can look at the cornea with scans, and after LASIK, everybody has chronic inflammation in the cornea, 100%. So it's a terrible procedure. Nobody should go near it.
And what are other symptoms? So there's dry eye, there's the halo. I even know people in my circle that have done LASIK twice because something went wrong, their vision wasn't clear enough, and so that they went in again. But what are other symptoms? And then what happens if you do LASIK again, even after the first time?
Well, that's even worse because you're recutting the eye, you're creating more scar tissue. You know, LASIK wears off.
Right. I've heard that.
After 4 years, about 30% are back in glasses, and after about 7 or 8 years, almost half of people are back in glasses because the cornea isn't a piece of plastic. It's living tissue that remodels through life. The cornea keeps adding more tissue. Sometimes patients go from being nearsighted to being farsighted, which is a terrible
Through
thing.
LASIK?
Through LASIK, yes. And nobody should have LASIK. It's too risky, and you never have a healthy eye again.
So why are if obviously the ophthalmologists study the eye and they understand nerves and how everything is a complex system and they understand inflammation. So is it really the money aspect of it that they don't speak up? I mean, I thought it's do no harm.
Well, do no harm is the vow we all take when we become doctors, the Hippocratic Oath. Hippocratic Oath, it's the hypocritical oath in this case. It's it's not right. It just isn't right. And I get nothing out of speaking out against LASIK. Zero. It's just costing me money and grief. And my colleagues say horrible things about me, but I just can't not speak out. I spent 40 years taking sick eyes and making them into healthy eyes. LASIK is taking healthy eyes and making them sick. How can you not speak out against that?
And you
It's,
think all ophthalmologists know this as a fact?
well, if they don't, they're not doing their homework. This is the book they should be reading.
So there's some people that don't watch this on video, so I'll call it out loud. The Unsightly Truth of Laser Vision Correction, LASIK Surgery Makes Healthy Eyes Sick by Dr. Morris Waxler. Okay.
Then I was a co-author.
Oh, okay, yes, you were a contributor, yes.
The back of this book has 11 pages of citations from the scientific literature. There are 150 citations documenting what happens to these eyes, documenting the glare and halos, documenting the thinning, which in some cases can cause the cornea to start bulging out and ruining vision, and you can't correct that. Documenting the dry eye. Every single statement we make in this book is backed up by the scientific literature. So I'm not making things up here.
Right.
I'm going by the science.
You also have work called Broken Eyes. Do you want to talk about that and some of the stories?
Yes, there's a lovely PBS documentary filmmaker. Her name is Dana Conroy, and she had LASIK and
Oh,
she became almost completely disabled. She can't drive at night. She's in horrible pain. She really can't see. She's completely changed the way she does the movies that she makes. She listens.
oh,
She can't see what's going on. I got together with her and financed this movie, Broken Eyes. And it takes 6 or 7 patients and goes through each patient, and the patient describes why they got LASIK, how they regret it. You know, Consumer Reports did a study and they found after 7 years, 55% of patients wish they'd never had LASIK.
wow.
So that movie is now available on YouTube. I can send you the link. You can give it to your many, many podcast viewers. And it's beautifully done. I don't know how she did it, how she possibly managed with all her visual disabilities to do that. But she did. And it's won many awards. It won Best Documentary and Best Film by a Woman at the Soho International Film Festival. It won Best Documentary in Dubai, the Dubai Film Festival. And there are many other places it's won awards, Minneapolis. So it's a good film, and everybody ought to watch it before they get sick.
I will put the film as well as the book in the show notes. I can't help but think that maybe some people will hear this and think, well, I don't, if it means that I don't have to ever wear glasses or wear contacts or have to go to the eye doctor, I'm willing to have dry eyes. Like that doesn't seem like a bad trade-off. What would you say to people that are thinking that?
I would say, first of all, you have a 60-time greater risk of having a retinal detachment,
Wow.
and you have about a 10% risk, 10.5% of getting something called chronic neuropathic pain. which is perfectly horrible. And you have to know there have been 30 or 40 suicides of people who had LASIK who killed themselves. Everyone is documented, and including some celebrities, this bobsledder, but it's not a laughing matter. And it's just to get rid of glasses. There's nothing
Right.
wrong with wearing glasses. Wrong with wearing contact lenses. You see great with the glasses. You should see great after this procedure, but you don't. That's the nasty little problem with LASIK.
What do you think drives what is it about the procedure that would drive people to end their life?
The chronic pain
Okay.
and
Okay.
the inability to see.
Right.
It's very depressing. If you are in horrible pain, have you ever scratched your eye or have you
Yes.
ever gotten a piece of dust in your eye?
It
It's not
hurts.
worse. You just can't, can't get rid of it, and it really hurts.
Right.
If you had that all over
Oh, wow.
both eyes and there wasn't any way to get rid of it, that's very depressing.
Yes.
It's nothing to laugh at.
So you think that in 20-ish years that eventually LASIK will be banned?
I hope so. Well, I think if you don't need to actually ban it. All you have to do is explain the truth about it.
Right.
And when you have surgery because you have a problem.
Right.
Maybe you have breast cancer and you need to have the cancer removed, or maybe you have a heart that has clogging in the arteries and you need to have a stent, or you've broken your hip and you need the hip fixed.
Right.
You're taking some part of your body that has a problem and you're fixing the problem. But with your eyes, there's nothing wrong with an eye that needs glasses, nothing wrong with my eyes. And to operate on that eye when there isn't a problem with it to begin with, it's crazy.
I'm curious how many ophthalmologists have ever gotten LASIK surgery themselves.
Not very many.
Interesting.
You'll see a lot of the LASIK surgeons wear glasses. I think the way to stop LASIK completely actually is to require that every LASIK surgeon has the procedure before he performs it on others. That'd stop it.
I
But
could
you
see that.
see these people, they don't listen to their patients. If they tell them they're in pain, they say, "Oh, you're crazy." They'll send them to psychiatrists. They'll laugh about it. They don't want to admit to themselves what they've done to these people. In Europe, there's been a fair amount of research done on how to help chronic eye pain, which is complicated, but basically you have to use an eye drop that's made from your own blood, taken from your own blood, and you have to take a pill that's actually an antidepressant. But they aren't doing that in this country. They're not doing research on how to solve these problems because that would admit
They're acknowledging the
there are
problem.
these problems. They're just not facing the truth. You're supposed to know about a procedure before you do it. You're
Right.
supposed to know how to handle the complications. And these people don't know how to handle the complications because most of them can't be handled. So they want to say the complications don't exist.
My friend that got LASIK, and this was before I knew that there were any issues, but she always complained about dry eye. So then she would just she now always carried eye drops. And I just thought, okay, I didn't think much of it. And then she was the one that also then over time, her vision she started needing glasses within 2 years. So then she got LASIK again. And I don't know if it was they covered it again. I'm not entirely sure about that. I don't think her vision has ever been the same since. But I don't think she ever thinks, I think she thinks it's more of a, oh, this is just the individual complication more than this is a common issue with LASIK. And it's unfortunate because I think most people that get LASIK think it's just, oh, I just have a little bit of dry eye, but at least I have this level of comfort now.
Yeah. If you talk to a patient who's had LASIK and says, oh, it's great, it's the greatest thing I ever did, just ask them, are your eyes dry? And they'll say, oh, yeah, I'm putting in drops every half hour.
Half
And then
hour,
you
wow.
just say, do you have any problems seeing at night? Oh, I had to give up driving at night. They're just not admitting the
Right.
complications. People who've had LASIK should have driver's licenses that restrict them to day driving
Wow.
because it's too dangerous. You're flying in airplanes with pilots who've had LASIK. You're driving in cars, and the cars coming at you have people that have had LASIK, and all they see with your headlights is dazzle and, 5 or 6 different headlights instead of one. So it's a public health hazard in addition to being an individual health hazard.
So what do you do if you've already had LASIK? So you didn't hear about this and now you're mad listening to this content. So what do you do to start supporting your eye health if you've already the book?
Okay, you take this book, and we have a whole chapter
Okay.
devoted to how to handle the complications of LASIK. We give the names of various ophthalmologists
Okay.
around the country who specialize in treating LASIK complications. That is their specialty. That's all
Wow.
they do day in and day out. They see suicidal, desperate patients who've had their eyes ruined, and they try to help them as best they can. You can't
Undo it.
reverse problems, you can just manage them somewhat. The third author down here, Ed Boschnick, is an optometrist, not an
Okay.
MD. He works in Florida, and his specialty is fitting a special kind of contact lens called a scleral lens to try and give these patients somewhat improved vision. Now, they're expensive and they're uncomfortable, but they do help not to return the sight to completely normal, but they do help the patients to see better. So,
I'm so shocked that there's procedure that makes it so simple, right? You just go in, and then you walk out a couple hours later and you have perfect vision. And there's a lot of darkness to this procedure that most people don't know, including myself. I didn't even know about any of this. And I was actually recommending my husband getting this. So I'm so glad he actually decided not to do it. How did this even come about? Like, who founded this and how did they think that this was the greatest invention?
well, Steve Trokel was the man who invented LASIK. As I told you, was a colleague of mine at the Edward S. Harkness Eye Institute in Columbia,
The one that showed you the picture.
who showed me the picture.
Okay.
And he then started a laser company, and then the FDA got involved, and people were doing it, ophthalmologists were doing it before the procedure was approved by
Approved?
the FDA.
Okay.
And it was a big mess. I mean, the story is told
In
in
this book.
this book.
Okay.
Morris Waxler was the head of the committee that approved LASIK.
Oh, wow.
And he ended up, after he started meeting some of these people, some of these desperate people, and getting to know them, he said, there's something wrong with this. She went back to the original data that the LASIK surgeons had submitted to the FDA, the original data. They had said, oh, these are all temporary minor side
Right.
effects. He looked at the 1 year follow up data, and he found an unacceptable number of people had horrible dry eye, unacceptable number couldn't see at night, unacceptable number had chronic corneal pain, and he started speaking out against it. And he really wanted to write this book, so with my help, and particularly Paula Kofer, who's a LASIK damaged patient herself. She was disabled from her job. She was a banker, very smart, capable woman. Now she has a LASIK support group for people who've had complications from LASIK. She's got a foundation that has money that gets doled out to people who have LASIK complications and they can't afford the drops, they can't afford the scleral contact lenses. And 100%, 100% of the profits from this book go to LASIK damaged patients.
Wow.
100%. We don't make a penny from this book. So
I'm
that's
sorry. I feel very saddened to hear that there's this, and I mean, why am I surprised with everything that goes on in the medical world? But it's saddening because it seems like such an easy option to no longer have to go and get your contacts and stuff. And who knew that there was so much harm? And so thank you for advocating for that book and even the film that you were part of. In terms of other options, do you recommend other options? I know that there are other types of therapies that you can improve your eyes that are beyond the contacts and glasses. Do you recommend any of those other modalities?
any modality that changes the shape of the cornea is going to injure the cornea.
Okay.
So eyes are nearsighted because they're longer than normal. They're farsighted because their eyes are shorter than normal. And in order to change the focus, 70% of the focusing power of the eye comes from the cornea, about 30% from the lens. In order to change the focus, you've got to change its shape. You change it from a perfect curve. You carve down the center in the case of nearsightedness. And now you have a mesa instead of a beautiful rounded hill. The cornea goes up and then it goes across and then down. And of course, at night when the pupil dilates, this area between the old curve and the new curve of the cornea is going to cause problems. You're going to be seeing two images at least because the old part of the cornea is going to focus down behind the eye. The new part is going to focus on the retina. This is the part of the eye that actually sees. So you're going to be seeing at least double. It's inevitable.
Right.
Anything that changes the shape of the cornea and remodels the cornea damages the cornea.
What do you think about gas permeable? Because I mean, it's temporary, but they also change the cornea a little bit, right?
Well, you can take a hard contact lens, gas permeable or not, and you can put it on the cornea and it flattens the cornea. And that means that temporarily, after you take it off, the eye sees, the focus is more on the retina, the eye sees better at distance. But in time, that pops out again.
Okay.
That is just momentary flattening. They call that orthokeratology.
Okay.
It's not something that lasts. It's not something that's very good for the cornea. You wear a hard contact lens, and when you scan the back surface of the cornea, these beautiful hexagonal little cells are all misshapen. Some are bigger, some are smaller, some have 5 sides instead of 6. You can see the damage.
From wearing hard contacts?
Yes, so it's not a good idea. Now, there is another little procedure where they actually put a little contact lens inside the eye.
Okay.
Instead of putting contact lens on the cornea, they put an intraocular lens inside the eye. Now, you can imagine how nice that is for the eye. I mean, it smashes up against the cornea and starts to destroy it. It causes chronic inflammation, and you start to get a cataract. And most of those little intraocular lenses get removed. At least it's reversible to a certain extent. But any procedure where you're going to take a nice normal eye and change it
It's not
is
ideal.
going to harm it. Now, if you develop a cataract, that's another situation, because then you take the cloudy lens out and you replace it where the old lens used to be with a lens, and then you can make the person perfectly focused. That's justifiable. That's an eye with a problem. It's got a cloudy lens, it's got a cataract. So that makes people very happy to have new sight that way. But anything else, some people have tried heating the cornea. It's all it's all bad. This is a fragile little clear structure. It's miraculous. It's not good to fiddle around with it, particularly not with all those nerves.
Right. So you're okay with soft contact lenses? Now I just have to ask since I asked about the hard contacts.
Well, soft contact lenses are much more comfortable. And nowadays, they even can correct astigmatism. So
Right.
that's pretty nice.
But it doesn't affect the eye structure.
But
Like it
it
won't make.
doesn't affect
Okay.
the structure of you got it.
Okay.
So actually, way, way, way back, the first person who tried to change the structure of the cornea was a mad Russian called Fyodorov. And he cut slits in the cornea. And that made that part of the eye bulge out and that flattened the cornea. But you can imagine how nice that was. Putting all these slits in the eye, very unpredictable, causing horrible irregular astigmatism. That was completely abandoned. Now they're doing the same thing, but you're doing it with a laser,
Right.
which is it's a femtosecond laser, which is more controlled, but it's still slicing the cornea, slicing through the nerves, cutting it, changing its shape, distorting its shape. There's nothing to change the cornea. You gotta do some kind of a procedure on it,
Okay.
right?
It just reminds me of back in the day, they used to do these psychology studies where if somebody was going through something, they would try to pick out parts of the brain and like maybe if we just remove this part of the brain, then they won't have these post-traumatic or maybe they'll be able to speak again or something. And then there were such detrimental effects by doing that. And it just sort of reminds me of that time of this. Well, let's see if we could just play with the cornea in some way. And it's quite scary. So one thing I want to ask you is about overall eye health. So, obviously macular degeneration, retinal, the retinopathy, diabetes affecting the eyes, and cataracts, glaucoma, etc. What is
Mhm.
the best way to support our eye health so that we don't get these illnesses, or is it just inevitable with age?
Well, macular degeneration is due to a gene. They
Okay.
discovered the gene.
Mm.
Actually, a woman discovered the gene, a woman at Yale. But it's much more likely to happen if you smoke
Interesting.
and if you eat a diet of very processed foods that doesn't have vitamins.
Mm.
So, to cut down your risk of getting macular degeneration, or to lower your risk or make it a more milder form or more delayed, don't smoke and eat a good diet. Also, see your eye doctor regularly,
Okay. What's
at
regular
least
to you?
once a year after 40,
Okay.
once a year. Particularly, that's important if you have eye disease in your family, if you
Okay.
have glaucoma, for example, in your family. Glaucoma is highly hereditary. I mean,
Mm.
my grandfather had it, one of my uncles had it, now one of my cousins had it. And if you're having regular eye exams, glaucoma will be picked up early and completely prevented. So, and with cataracts operation is the safest operation in medicine. Its
Okay.
chance of anything going wrong is less than a tenth of 1%. So, if you want to have good eyesight, see an eye doctor and see an MD. Optometrists call themselves doctors, and they've had a certain amount of training in the eye. but they're not trained to diagnose and treat eye diseases. So see your optometrist for glasses, for drops, for contact lenses, but that doesn't say you've had a complete checkup for diseases like glaucoma and retinal tears, for example. So every year, once a year, regularly see an ophthalmologist,
Okay.
an MD, who can care for the eye.
Could you bypass going to the optometrist and do sort of one visit a year with just the ophthalmologist to make sure you're
Sure,
okay?
if you don't need glasses, yes. I mean, you must see an ophthalmologist
Okay.
once a year. And you can also see an optometrist for contact lenses or glasses, but that's not having a comprehensive checkup.
Are there any lifestyle factors? So obviously you mentioned diet, then you mentioned smoking and not smoking. Are there other ways that we can support our eye health as we are, getting older?
Absolutely. Probably one of the most important is to wear eye protection
Mm,
if you do contact sports.
okay.
I have treated so many patients who got a tennis ball in their eye, a squash ball in their eye. And the problem with that is the outcome depends almost entirely on how bad the injury is, because there's certain injuries that you just can't do anything about. And I have had patients that are blinded because of injuries to the eye. You go to any good optician and they'll have lots of eye protection.
Okay.
When you get older, when you're over 40 and you have had menopause, then it's time to think about starting to take eye drops a couple of times a day, because these people get changes in their tear film and they get a dry eye. And of course, with children, the thing you have to really be on the lookout for is whether the eyes cross in or cross out, because that usually means that one of the eyes isn't seeing properly. And that has to be picked up and treated very young. So these are all ways you could keep your eyes healthy.
If you don't pick that up early and treat it for children, what happens to those eyes? Is it that one just becomes weaker?
Well, it's called a lazy eye.
Right.
If a child has eyes that cross in or cross out, the brain just goes crazy because it doesn't know
Right.
what's the sight is. So it will start to turn off one of the eyes.
Oh, wow.
And this is a problem that occurs in the connection between the optic nerve and the brain. Even if you say find out this child has a cataract, or this child is very nearsighted or very farsighted, once they're over the age of 4 or 5, you can't fix that.
Oh,
So it's very important with crossed eyes or eyes going out to see an ophthalmologist that specializes in children. They will figure out why the crossing is occurring. Usually it's because one of the eyes isn't seeing as well as the other eyes, but sometimes it's just because there's a family tendency for that to happen. In an emergency, what would send you to an eye doctor is if there's pain in one of the eyes. Don't ignore it. It could be many, many things. It could be a little virus infection of the cornea. It could be inflammation within the eye. It could be even an attack of angle closure glaucoma. Never ignore pain in an eye. That's so important. LASIK is a cosmetic procedure. You don't need LASIK. It's like a tummy tuck or a
sure.
breast enhancement. You don't need to have LASIK. It's cosmetic. It's unnecessary surgery done on a healthy eye that turns it into a unhealthy.
Is
Great.
there a way that people can reach out to you? Do you have a website that people can learn more about?
Sure. It's iDoc Mackay, EYEDOCMACKAY. Or you can just Google Cynthia J. Mackay, MD, and that will get to my website.
Okay.
And also I'm on Twitter, I'm on Facebook, I'm on Instagram, I'm on the social media sites. So you can find me one way or another.
Well, thank you so much again for your time. I think most people never question that there would be ever an issue with LASIK. And I think even if people have heard about dry eye, they think it's a temporary issue that goes away, but you get glorious vision. And so it is so worth getting. It's quick, it's not too expensive. And most people don't hear the side that you're sharing. So I just had to have you on. So again, thank you so much for the work and just sharing this information when you didn't have to retire and share any of this information.
Well, thank you so much for saving sight. Sight is worthy of saving. You would miss your vision if you didn't have it. And if you can persuade people not to have a procedure that has a 100% risk of making you see worse, you will have done great good. So thank you.
Thank you again. I hope that this conversation gives you a lot to think about. I genuinely thought that LASIK has no issues and that it's just a procedure that gives you better eye health because technology is wonderful. It's crazy that I started in the nutrition space and thought that the medical system was broken, especially in dietetics and eating disorder facilities, because that was where I had my struggles. And then learning that eating a plant-based diet was not ideal for my health. And actually, it wasn't ideal for anyone's health, any human or even pet's health. And so learning that has now forayed me into all of these other establishments for wellness and health, that there is corruption or there is stuff that is not shared with the public for a lot of the things that we do. I hope that in any decision you make with your health, your body, that you look into it twice or three times before you get anything done. I believe that God has designed us exactly the way we were supposed to be. And sure, if there was a mismatch or if there was an incorrection that we need to correct, then so be it. But for example, when we just readily remove our tonsils are the first line of defense from an immune system perspective. And so for some people, once they remove their tonsils, they will always have risks of certain pulmonary issues. I'm just bringing up this random fact because I'm writing my book. But we should always consider what are the pros and cons and then make a more informed decision when we do it. As much as I knew about nutrition and wellness and chronic illness, I never questioned LASIK. And when I started looking down the rabbit hole, I was in shock. And I wanted you guys to also hear the sad truths of the stuff I learned. Okay, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.